All right, hi everyone. So, we are now going into a discussion on the respiratory system terminology. So, um, an introduction to the respiratory system. There's a few things to go through anatomy wise that will be important uh, for you to know. If you are in anatomy and physiology currently, this will just be review. So, what we have at the very top is going to be the nose. The air enters into the nose, where the nose serves to what we call conditioning of the air, where it becomes warmed and it becomes humidified, because both of those things help enhance lung function. As it moves through the nose, it hits the space back here. This is called the nasopharynx. Now, it's also possible to breathe air in through your mouth. So air would come into the mouth and enter the oral cavity, and then eventually into this backspace here called the oropharynx. Now, as air travels further inferiorly, we hit the split where air is either going to the respiratory system or it's going to enter the digestive system into the stomach, because throughout this space, the digestive system and respiratory system are overlapping. Okay, so essentially, this whole space up here is going to be, and including the larynx, is considered upper respiratory. Okay, so there is a almost like a flap of tissue that you can see kind of shown right here called the epiglottis. The epiglottis closes over the larynx when like swallowing food or water to allow it to only go down to the stomach, down the esophagus. When breathing, though, the epiglottis stays open, and that allows air to travel into the trachea. So, next, air will then enter the larynx. This area can also be called the laryngopharynx. The larynx, though, is commonly known as the voice box. Okay, what you see here is actually the illustration for cartilage. This is the tongue. The tongue actually is a very interesting muscle, or actually, it's a group of muscles. But what you see here, this cartilage, is called laryngeal cartilage, or can also be referred to as thyroid cartilage. Very large, very robust, and it's what makes what's called the laryngeal prominence in the throat, also known as the Adam's apple. So, as you enter this essentially cartilaginous tube, you eventually hit a point below the larynx where the cartilage changes properties, and you get a slightly different mucosal membrane, and you've entered the trachea at that point. Trachea is made up of cartilaginous rings, as you can see here. They're illustrated with the lines, and they are C-shaped, which is very important. They're C-shaped because the esophagus is literally on the posterior side of the trachea. So that allows the esophagus to sit on the backside of the trachea. Now, air comes down. You're going to hit a split right here. This split is where the bronchial tree essentially begins. So the trachea will split into the right-left primary bronchi, and from that point on, you begin to undergo branching. There is lots and lots and lots of branching in the lung, okay? And with the bronchial tree, you kind of have two different components to it. There's the conducting zone, which essentially exists just to transport air, and then we have what's actually called the respiratory zone, where there's actually structures that exist that can take oxygen out of the lungs and bring it into the blood. And These structures are called alveoli. Alveoli, they kind of look like little sacs clustered together, kind of like grapes on a vine. Incredibly thin, all right? And there's going to be capillaries essentially touching the alveoli. And that's how with a little bit of physics and biochemistry action based on what's called partial pressures, oxygen will essentially diffuse out of the alveoli and into the blood. And the reverse happens from the blood, where carbon dioxide and other waste like nitrogen gas will diffuse out into the alveoli, where then the waste tissue, upon exhalation, it gets pushed up and out, and that's what we exhale. All right. It's a relatively simple system. It's pretty much tubes all the way until you hit an alveoli. So again, function moves air in and out of the lungs, which provides the intake of oxygen and release of carbon dioxide. It also exists, again, because air goes through the larynx, also known as the voice box. It's how speech is formed, and via the nose, the inhalation of air allows us to smell the environment around us via our special senses. So what you see here is just an outline of what the air travels through via inhalation or exhalation. So now we're getting into word parts. So broncho, what you see for that is the bronchus or bronchi. This is, again, part of the lung, part of the conducting pathway of the lung. And bronchioles, specifically respiratory bronchioles, are also part of the respiratory component of the lung as well. But just think about the tubing within the lung when you say broncho, all right? Capno, carbon dioxide. Laryngo, again, larynx. Muco, mucus, so like mucosal. Naso is nose, but so is rhino, okay? So we can have something called a rhinovirus or a rhinoplasty, all right? Rhinoplasties are the official term for what is commonly known as a nose job. Ox or oxy is oxygen. Pharyngo, again, pharynx. So remember, it gets pretty easy. These are anatomical names when you start to talk about like pharyngo or broncho, okay? Pneumo or pneumono is what we're actually using to describe lung. Pulmono or like pulmonary, words like that are also describing lungs, okay? Sinuso, sinuses, you might have a word like sinusitis, which is a sinus infection. Even though it means directly, inflammation of the sinuses, that inflammation occurs because of a infection. Spiro, this is talking about the act of breathing. So you might use a diagnostic test called spirometry, where we are measuring different aspects of the ability to breathe. Thoraco is chest, and specifically we're talking about the thorax area. So that is the space below the neck, but above the abdominal cavity. And the thorax contains essentially the lungs, the heart. You've got a lot of the major blood vessels like the aorta, stuff of that nature. We'll also probably see this term in the cardiovascular discussion as well. Tracheo, again, just like trachea, a lot of these things are essentially almost word or sound for sound with the anatomy that it's describing. Suffixes, again, some of these are we've already seen before. So eel or airy pertaining to synthesis. Synthesis is a very good one. It's a surgical puncture that has a purpose to remove fluid. An ectomy is a surgical removal. IA is a disease state or a condition. Meter, this might be new, but we've talked about tools that are used to measure. So you can talk about a spirometer. That is the tool used in spirometry. So a spirometer is going to measure breathing ability. And then pnea is another term for talking about breathing as a suffix. So in this case, we can talk about a term like dyspnea, where we're talking about trouble with breathing. Okay, so like dysfunctional breathing. Next is regia, kind of like hemorrhage. It's important to remember that the H is pretty much silent here. We just use the A sound. Rhea is a flow or discharge. You've heard this term before with diarrhea. There's scope, scopic, scopy. We already know these by this point. We've already seen them. Again, stomy might be a new one, but it's the creation of an opening. Okay. And then again, thorax can also be used as a suffix as well. Prefixes a or an is essentially without. Dis is difficult, painful, abnormal, you could say dysfunctional, etc. Any of those synonyms work. Endo, within, so we can talk about endo, well, in this case, the first thing that comes to mind is like endocarditis. That's the inflammation of the inner cardiac or inner heart tissue layer. Okay. Hyper, again, above, excessive. And remember, hypo is specifically referring to a measurement. So we talk here about apnea. So commonly you'll hear something like the diagnosis of sleep apnea. Apnea essentially literally translates to without breathing, okay? Because individuals will literally stop breathing for short periods of time while sleeping if they have sleep apnea. And there's many different reasons it can occur, but it's a potentially very dangerous condition. Bronchitis is inflammation of the bronchi. It's a general term. It can be used to describe several different things. It could be an infection. It could be like caused by an allergy. We have a bronchopneumonia, which is pneumonia specifically of the bronchi. Again, dyspnea is difficulty breathing. Endotracheal, you're talking about like the endotracheal lining, the endotracheal mucosal layer. That means within the trachea itself. Hyperoxia, not really a word we see much. Hyperoxia talks about it's literally saying too much oxygen, but it's very difficult to get too much oxygen. Hyperpnea is excess breathing, okay? And that can happen, and you might think about that as like hyperventilation is another word that's very similar to that. Another thing, laryngitis. So that's inflammation of the voice box. Very common. Sometimes you get laryngitis. You've lost your voice. It becomes hard to talk. Laryngeal, again, this is talking about specifically, a term where something is about the larynx. Mucoid, mucus. Again, mucus is a substance that is secreted by what's called a goblet cell. Has a lot of functions, but it can be important in respiratory function if there's excess mucus. because it can cause coughing, etc. Nasopharyngitis. So we would be talking about condition where there's inflammation in both the nose and the pharynx. Pneumonia is essentially a disease of the lung. And then we talk about like pneumothorax. Pneumothorax is right here. So a pneumothorax condition is essentially describing a collapsed lung within the chest cavity. Okay. And the problem with this is that there is air actually filling the space around the lung when the lung collapses. It's going to happen for various different reasons, but it's definitely not a fun experience. All right, so we got more words here. Some of these are repeating at this point. Now we're getting into some various like procedural parts where we talk about tools or procedures. So like we talk about endoscope. That's a scope that's going to go within the body. You can use an endoscope to go down the pharynx, into the larynx and into the trachea. You can do it down in the esophagus, etc. It's a very pretty much it's just a camera that basically goes into the body. A laryngoscope, specifically, we'd be talking about the tool used when you go to the doctor and it's got the little light on it and you open your mouth and you go, ah, that's what they're looking through. That's a laryngoscope because they're looking at the larynx. So you see here a bronchoscope. So this is a specialized scope where pretty much a very small tube is fed down into the trachea. It's got a camera on the end of it. Sometimes if you're looking for something that you're pretty certain is there, there's also the ability to use the scope to take like biopsies. Very, very important tool for examining the pathway to the lung, though. So what you see here with the laryngoscope, this is being used a little differently, but in this case, it's helping intubate the patient in this case. So diagnostic terms, again, I've covered several of these already. With a thoracoscope, what you essentially do, it's a very similar idea to like an arthroscopic procedure where you make a very small incision in this time in the thoracic cavity instead of the joint cavity, and you're going to insert the small camera and scope to take a look around. So surgical terms, big one to talk about here is thoracocentesis. This is where you're actually using a relatively large needle, and you're going to be draining what's called pleural effusion. It's basically fluid that's outside of the lung. So we got some disease conditions to talk about. Asthma. Asthma is characterized essentially by spastic breathing patterns that aren't voluntary. We have chronic obstructive pulmonary disease, also known as COPD. It's a disease it's like a category of diseases. The general idea, though, is that these diseases make it harder to breathe. Emphysema is a type of COPD. Emphysema is characterized by air essentially getting trapped in the lungs. Okay, so that's actually going to heavily reduce the ability to breathe. Influenza, caused by the influenza virus. It's just the scientific term for the flu. Next is, again, obstructive sleep apnea. Talked about this a few minutes ago. And then upper respiratory infections. Very common. That's basically everything above it's like pretty much just trachea and above. All right. Diagnostic tests and equipment. CT scans, chest x-rays, and sputum cultures. So sputum is the term used for the mucus that you kind of cough up, spit up, etc. You can do a culture on that mucus to see if there is like a bacterial infection. So what you see here with obstructive sleep apnea in this form, the individual's tongue actually rolls back and closes off their airway and physically obstructs the ability to breathe. All right. Again, as I said before, it can be a very dangerous condition. So what you're going to see here, bunch of abbreviations. These have already been defined, if you've noticed throughout. One thing we haven't talked about yet, you'll see TB. TB means tuberculosis. It's a highly contagious infection of the lung, characterized by bacteria. So here you're going to see a chest x-ray. So chest x-rays are a very important diagnostic tool. What you can see in a chest x-ray is if the lung is healthy or not. You might get a little bit of shadow on a chest x-ray, but the idea is generally what we see with the chest x-ray with air, you're going to see a dark colored space. So you see dark really well right here, right? So we call that lucent or radiolucent, and that is the air. So this space outlined where there's a lot of darkness under the ribs, because again, we can see the ribs essentially coming from the back to the front. And interestingly enough, what you see outlined right here is actually the heart. Okay, so the heart leaves a very nice shadow on x-rays. And again, that's actually essentially what an x-ray is. It's a shadow of the body. Right down the middle here, you can make out some structures that you would have seen last week. As I mentioned before, the ribs are here. You've got your clavicle right here, and you can kind of see the scapula there as well. But we've got the lumbar vertebrae. You can make it out just a little bit, and you can see in between them the intervertebral discs. Okay? Or I said lumbar. These are thoracic vertebrae. The sternum is up here. So we've got the manubrium of the sternum. The xiphoid would be somewhere around here. But what's interesting with the chest x-ray, you look at this white area. And remember, this is lung. We shouldn't really be seeing much white here. This could indicate something like pneumonia. All right? So this could be inflammation within the lung, because that's going to be water shows up on an x-ray slightly different colored than air. It's going to be a little bit brighter. In fact, the color that you see right here would be more indicative to what we would describe kind of as water. Okay, so tissues with lots of water or inflammation can show up a little brighter than air. And you can really, if you really look at it, you can see the branching of the bronchial tree here as well. And if anyone else is curious, what we see here is pretty much the diaphragm as well. Okay. So again, you're looking at a CT scan here. CT scans are computerized images where we can slice the body into various different planes. It's going to be a little more better to see soft tissues than a X-ray, and we can really see things like inflammation and fluid buildup. So if you want to orient yourself here, this is part of the sternum right there. What we're going to be seeing here, this is a thoracic vertebrae. This is the body of the vertebrae. You've got the spinous process, transverse process is here. The spinal cord is this right here. And what you'll see is the rib, actually. So this would be the rib coming off of this thoracic vertebrae. So what does that mean this is? This is part of the thoracic cavity. This is lung, all right? And we can kind of see right here some sort of different colored item. Now, can't tell for sure what that is because this is just one plane. So, what's the abbreviation for computed tomography scan? A CAT scan. All right, so quick review of abbreviations. TB is tuberculosis, SOB, shortness of breath, flu, influenza, COPD, chronic obstructive pulmonary disease, and OSA is obstructive sleep apnea. So, here's something for you to think about. What's the abbreviations for these definitions? A progressive lung disease that restricts airflow, which makes breathing difficult. What would that be? COPD. An infectious bacterial disease most commonly spread by inhalation of small particles and usually affecting the lungs. That would be tuberculosis. All right, so that is it for the respiratory.